Ovarian cancer explained. Why is it silent and how we treat it today? Ovarian cancer is often described as a silent cancer, but it is not truly silent. It speaks quietly, it actually whispers, and we often fail to listen. Hello everyone, I'm Dr. Imaan from SSO Hospitals. Ovarian cancer does not begin with dramatic pain or visible bleeding. It starts with subtle persistent symptoms. Women often describe feeling bloated almost daily. They feel fuller after eating small amounts of food. Their abdomen may gradually increase in size. There may be vague pelvic heaviness or mild back discomfort. Because these symptoms overlap with common digestive issues, they are frequently treated as acidity, gas, or lifestyle problems. That delay is the real problem. The key difference between harmless bloating and something concerning is persistence and frequency. If symptoms are present almost daily for 2 to 3 weeks, particularly in women above 40 years of age, evaluation becomes necessary. Unlike cervical cancer, we do not have universally reliable screening test for ovarian cancer. CA-125 is a blood marker that may rise in ovarian cancer but can also increase in benign conditions like endometriosis or a pelvic infection. Ultrasound helps identify ovarian masses, but it does not always tell us whether they are malignant. So, diagnosis is a combination of clinical suspicion, imaging, blood tests, and sometimes surgical exploration. Once ovarian cancer is diagnosed, treatment planning becomes critical. The backbone of the treatment is surgery. The goal is something called complete cytoreduction. This means removing all the visible tumor deposits inside the abdomen. Ovarian cancer tends to spread within the peritoneal cavity. It may involve the ovaries, uterus, omentum, bowel surfaces, diaphragm, and the lymph nodes. This surgery can therefore be extensive and requires careful planning. Why is complete removal so important? Because multiple studies have shown that survival outcomes are directly linked to the amount of the tumor that is left behind after surgery. When no viable disease remains, chemotherapy works more effectively. In some cases, chemotherapy is given before surgery to shrink the disease. In others, surgery is done first. The decision depends on the disease spread and the patient fitness. After surgery, chemotherapy is usually administered to target the microscopic diseases. The most important message is this: ovarian cancer often gives early signs, signals, but they are vague. Persistent bloating, early satiety, and abdominal swelling should never be ignored if they are continuous for weeks. Early detection means simpler surgery, less extensive spread, and better long-term survival. Listening to early changes improves outcomes.